Hello everyone. Welcome to CNO's webinar on RN prescribing. My name is Jennifer Chang, and I'm a registered nurse and an advanced practice consultant with the College of Nurses of Ontario. In this webinar, I will provide an overview of RN prescribing and the education requirements in order to be authorized to prescribe. I'll also discuss the RN prescribing practice standard, and lastly, go over the regulation changes that have been made for all nurses related to medication practices. Now, when we speak about RNs with prescribing authority, we're referring to RNs in the general class, not to be confused with RNs in the extended class, otherwise known as nurse practitioners. NPs have a much broader and expanded scope of practice, but this is not the focus of the webinar. It's important to note that RN prescribing is very new in Ontario and in the early stages of its implementation. RN prescribing work began a few years ago when the Ontario government made changes to the Nursing Act to enable this expanded scope change. This work was put on hold due to the pandemic and resumed again in 2023. In November of 2023, the Ontario government approved the regulations under the Nursing Act to permit registered nurses in the general class who meet specific requirements to prescribe certain medications and communicate a diagnosis that they have made for the purposes of prescribing those medications. RNs with prescribing authority will also be able to dispense or administer by injection or inhalation a medication that they have prescribed. This change was made to improve access to care. There are also other legislative changes related to medication practices for all nurses, which are listed on the slide but will be reviewed later in the presentation. We are first going to start with RN prescribing. So what are the requirements before RNs are permitted to prescribe? They include that RNs must be registered in the general class. So this means that registrants in the temporary class and other applicants will have to first become registered in the general class to become authorized. They must successfully complete education approved by CNO's Council, and RNs must ensure that RN prescribing is permitted by all relevant legislation and employer policies. For example, nurses who work in the hospital will not be permitted to prescribe due to the Public Hospitals Act. And in other settings, while prescribing may be permitted, there may be restrictions as to what they can prescribe. So we really want to encourage all nurses to discuss with their employer if RN prescribing will be permitted in their practice setting. So in order to become authorized to prescribe, RNs in the general class must complete council-approved education. This education has been designed to educate RNs to safely integrate this expanded scope into their practice. The education is based on and teaches the legislated scope of practice for RN prescribing in Ontario. It's important to note that RNs who successfully complete council-approved RN prescribing education have the authority to prescribe. However, as mentioned, some practice environments may not allow for RN prescribing. Again, RNs who are considering expanding their scope to prescribe should consult with their employers to confirm if RN prescribing will be supported in their practice settings before they enroll into the program. How were the RN prescribing education programs developed? Programs were developed and will be implemented and maintained by some schools of nursing that offer council-approved baccalaureate nursing programs in conjunction with their continuing education department. These programs build on and expand upon the competencies of the RN and will prepare RNs with the knowledge, skill, and judgment to safely incorporate prescribing into their nursing practice. So how were the programs reviewed? Approving RN prescribing education programs is an important part of Council's accountability to protect the public. CNO worked very closely with academic institutions that express interest in developing and delivering RN prescribing education to help them understand the requirements of the approval process. And the review process consisted of programs meeting the requirements of 5 indicators. These indicators are a subset of program and curriculum review from CNO's existing program approval framework, identified to specifically assess RN prescribing education. 5 indicators were identified, and these were program description. It's where we reviewed the RN prescribing education program and how it will support the nurse to obtain the RN prescribing competencies and prepare them to safely integrate prescribing into their practice. The second is program governance. We assess the governance structure for the delivery of the education. For example, we assess aspects such as how program partners are involved and communication structures. Third, program curriculum. We reviewed the full integration of RN prescribing competencies, including how and where concepts are taught, opportunities for application of knowledge, and evaluation strategies. And the fourth is program curriculum review structure. This focused on the curriculum development and review process. For example, how changes are communicated to those involved in the program. And lastly, clinical placements and preceptors. We assess the program's coordinated approach to safe clinical placements and preceptorship that meets program objectives. For example, we looked at infrastructure for handling unexpected practice issues and challenges. So this was a rigorous assessment which ensures that RNs who complete this education are prepared to safely incorporate prescribing into their nursing practice. This process will also be applied to any additional RN prescribing education programs that are proposed. As RN prescribing evolves, CNO will continue to monitor changes and will be in contact with the schools to ensure that changes are integrated into the programs. At December Council, 4 new RN prescribing education programs were approved. These programs are currently on the CNO website. The programs offer options and flexibility for interested RNs. The programs are available virtually and across much of the province. Each program has their own admission criteria and completion requirements. They have different characteristics, for example, variation in program length and number of courses. All of these programs have met our rigorous assessment criteria, and we encourage interested RNs to contact the program directly with their questions. RNs who successfully complete council-approved RN prescribing education will have information added to their registrant profile on CNO's public register, Find a Nurse. There is no distinct class or certificate of registration. The RN will be notified by the CNO that they have the authority to prescribe after eligibility is verified. For other nurses who are not prescribers, there will be no change to their Find a Nurse profile. RN prescribing, again, is optional, and it is available to RNs in the general class who want to practice in this new expanded scope. To further support nurses in this new scope expansion, a new practice standard has been developed to support nurses and system partners understand the legislative scope of practice and associated accountabilities. This new practice standard expands on the accountabilities that are found in the Code of Conduct, as well as other practice standards such as the Medication and Scope of Practice Standard. RNs are expected to practice in compliance with all relevant legislation, the standards of practice of the profession, and applicable employer policies. Similar to the Scope of Practice Standard, it follows 3 key concepts: authority, competence, and safety. Each concept includes a list of nursing accountabilities. The first concept is authority. So in addition to meeting the education and legislative requirements, the Nursing Act requires that RNs who prescribe must have a therapeutic nurse-client relationship with the client, prescribe for therapeutic purposes only, prescribe only the medications permitted, and, where applicable, in compliance with the route and indication of administration indicated, as well as ensuring all required information is on the prescription. Competence. Competence to prescribe includes being able to perform a health assessment, formulate a diagnosis, and provide therapeutic management that's appropriate to the diagnosis. RNs with prescribing authority must ensure that they have the knowledge, skill, and judgment to safely, effectively, and ethically prescribe a medication. This includes that nurses must consider what's in the best interest for the client, for example, reviewing any medication history necessary, ensuring the best available treatment option is within the RN's competence and prescribing authority, as well as being able to manage any outcomes. Nurses must also consider monitoring and documenting the client's response to medication. And as with all activities, nurses are required to self-reflect, identify their own learning needs, and continuously seek out and integrate learning to improve their competence in relation to their practice. And as always, participate in CNO's Quality Assurance Program. So in addition to having the authority and competence, an RN with prescribing authority must also consider when collaboration, consultation, and referral are necessary. Nurses must only prescribe medication from the approved list that is safe and supported by evidence, have access to necessary resources to prescribe safely, and consult or transfer care when needed. Here is a list of specific medications and categories of medications that RNs are authorized to prescribe. This list includes immunizations, contraception, travel health, anesthetics, topical wound care, smoking cessation, over-the-counter drugs, and epinephrine for allergic reactions. No other medication can be prescribed by RNs with prescribing authority if it is not included on this list. And as a reminder, this list can be found in the RN Prescribing Practice Standard in Appendix A. I am now going to discuss the changes related to medication practices for all nurses. As a result of the regulation changes, there were other practice standards that required revisions and updates. In the Scope of Practice Standard, we updated the content to include the expanded scope of RNs with prescribing authority, similar to what is outlined in the RN Prescribing Standard. It also includes that RNs and RPNs may accept an order from the RN with prescribing authority to dispense or administer medication, which includes by injection or inhalation, which are controlled acts, provided that RN prescribing is permitted in your practice setting. Changes to the Medication Practice Standard includes that all nurses who dispense medications or administer medication by injection or inhalation, regardless of the authorizing provider, must have a therapeutic nurse-client relationship when engaging in medication practices, only dispense or administer medication by injection or inhalation for therapeutic purposes, and include specific information on the medication container, as well as documenting and retaining a copy in the client's health record. And the last revision we made was to the Nurse Practitioner Practice Standard. These revisions are very minor and involve removing certain dispensing conditions. Previously, NPs were only permitted to dispense medication in specific circumstances. For example, if the client did not have reasonable or timely access to a pharmacy. These changes were made as quality improvement, making it easier for the public to access medications and to align practice for all nurses when it comes to dispensing medication. What's next? CNO's work on RN prescribing is in response to government's request. And like any change in nursing practice, our immediate focus is supporting nurses and other system partners to understand the changes and support safe practice. As RN prescribing continues, we'll also continue to evolve our practice resources. And as mentioned earlier, we're still in the early stages of implementing this practice change. If you have any questions related to RN prescribing, please note our responses will be based on the current state, and we do expect RN prescribing will continue to evolve as more RNs become authorized into the system and we continue our evaluation. I'd also like to highlight some of the additional and updated resources that nurses can find on our website, cno.org. We have lots of FAQs on RN prescribing, both for nurses and for employers, new decision trees, and we've also modernized our medication decision trees. We've taken them out of the medication standard and are now a standalone resource under the Standards and Guidelines page. We've also updated our Ask Practice FAQs. All of these resources are available in both English and in French. If you have any further questions related to RN prescribing, you're welcome to complete a practice support form, and one of our advanced practice consultants will respond. I encourage you to stay tuned and continue to check our website for any updates on RN prescribing. This concludes the webinar on RN prescribing, and we want to thank you for your participation.